This may be a bit sudden, but here's a medical quiz. What do you think this black line on the nail is? Actually, signs of cancer or internal diseases can sometimes appear on your nails. Do you usually take a close look at your own nails? You don't really get many chances to do that, do you? This time, I'll introduce 9 warning signs your nails may be showing that are useful to know, and you might regret not knowing. It's interesting as trivia too, so be sure to check your own nails and see if there are any changes. By the way, I'll explain the nail quiz from the beginning in the second half, so please watch until the end. There are all kinds of videos about health. Most of them are easy to understand, but some contain mistakes or can be misleading. At YouTube Medical University, we explain why certain symptoms appear, showing data and taking responsibility to make it easy to understand. The videos might be a bit long, but I hope you'll listen. First, I'll introduce 6 conditions that cause changes in nail color. Let's get started. These are things you'll regret not knowing. 9 warning signs your nails may be showing. The first one is when your nails turn white or become itchy. Seeing is believing, so please take a look at this image. Can you see that part of the nail has turned white here? This is actually a fungal infection of the nail. Athlete's foot is commonly known for causing peeling skin on the toes, but when it infects the nails can turn white and become itchy. It's well known that athlete's foot is contagious, right? Nail fungus can also spread to others, so please check if your nails have turned white. If the infection lasts a long time, your nails can become thick. Make sure to check both your own nails and your family's nails to see if they have become thick. If it's athlete's foot on the skin, it often can be treated with topical medication, but in the case of nail fungus, oral medication may be necessary, so please visit a dermatologist and consult with them. You'll regret it if you don't know about this. 9 warning signs your nails may be showing. The second one is green nail syndrome. Please take a look at this image. Here, the nail is nicely painted white with nail polish, but this green part is not nail polish. This is actually called green nail, and it's a sign that bacteria have infected the nail. As you can see in this image, even with nail polish on, it's especially common among women. The reason it's more common in women who get their nails done is because the infected bacteria is called Pseudomonas aeruginosa, and it prefers moist environments. In most cases, the bacteria get in between the natural nail and the artificial nail and start to spread. When this happens, removing the nail polish may be necessary, and in some cases, the nail may need to be filed down or medication may be prescribed. Please consider seeing a dermatologist before it gets worse. You'll regret it if you don't know. The third warning sign your nails may be showing is this. It's called longitudinal ridges of the nail. It looks as if there are vertical wrinkles on the nail. I often see nails like this in my outpatient clinic, and although I called it an SOS sign, there's actually nothing to worry about with this type of nail. It's said to be a change that occurs in the nails with aging, so just because you have this doesn't mean you need to rush to the hospital or that it's a sign of some disease. That's not the case. Just as wrinkles form on your skin as you age, vertical ridges can also appear on your nails as you get older. You'll regret it if you don't know this. 9 SOS signs from your nails. The fourth one is this. Can you see that the nail has turned white? Normally, most of the nails should be pink with a thin white area at the base, but in this photo, most of the nail is white and only a small part is pink. This is called Terry's nails. It's called Terry's nails because it was discovered by Mr. Terry. Actually, Terry's nails could be a sign of a serious illness. It may indicate conditions such as heart failure, liver disease, diabetes, or kidney failure. In other words, it could be a sign of problems with the heart, liver, kidneys, or even the pancreas, which plays an important role in diabetes. So if you notice this kind of symptom, please consult your regular doctor or hospital. And if you don't have a regular hospital, please visit a nearby clinic and consult with them. You'll regret it if you don't know about this. 9 warning signs from your nails. Here's the 5th one. This one is not so much about the nail itself, but rather redness around the nail. If you look closely at the image, you can see that there are scattered red areas around the nail. This is called periungual erythema. In fact, this could also be a sign of an underlying serious illness. What kind of disease could it be? It might be an early symptom of a group of conditions called connective tissue diseases. You may not be familiar with the term connective tissue disease, but have you heard of rheumatoid arthritis? It's a disease where the joints in your hands become painful, and if it progresses, your hands can become deformed. Rheumatoid arthritis is said to be one type of connective tissue disease. Usually, your immune system fights germs, but sometimes it mistakenly attacks your joints and body. That's what we call a connective tissue disease. One of the symptoms of this is redness around the nails. Since these signs can appear, please check if the area around your nails is red. If it is, see if you have any joint pain anywhere in your body. That could possibly be an early symptom of a disease. Of course, there are other things that can cause similar symptoms, like washing dishes too much. Some people may also have rough hands from working hard at jobs that require frequent use of their hands. But if the roughness is only around your nails, that could be a sign that something is wrong, so please consider seeing a doctor. You might regret it if you don't know about this. 9 SOS signs from your nails. The 6th one is what I mentioned in the quiz at the beginning. A black line running through your nail. That's the symptom. When you see a black line on your nail, it can be divided into 2 main patterns, benign or malignant. As for benign ones, meaning those that are generally harmless if left alone, the main example is something called longitudinal melanonichia. The name sounds complicated and hard to understand, right? It's simple. Just think of it as a mole on your nail. Just like moles can appear on your skin, moles can also appear on your nails. Our nails are said to grow about 1 millimeter every 10 days, and there's a nail factory at the base of the nail. If pigment producing cells get into this nail factory, the nails that are produced will have pigment in them. A mole on the nail forms, and as the nail continues to grow, a straight black vertical line appears upward along the nail. If you think about the reason, it's easy to understand. This kind of finding often happens in children as well, but in children, these moles are usually benign. So what kinds of malignant ones are there? That would be melanoma, which is a type of skin cancer. Actually, this skin cancer called melanoma can sometimes cause the nail to turn black as an early symptom. As it progresses, the black area on the nail can spread, like you see in this image, and the skin under the nail can also become black. When you see signs like these, there is a possibility that it could be melanoma, which is a type of cancer. Please make sure to consider seeing a dermatologist. So while most black lines on the nails are benign and usually not a problem, it's important to observe them carefully. Check daily to see if the black line is getting thicker, spreading, or if the skin is also turning black. Please keep an eye on these things. Now let's review the 6 conditions that can cause changes in nail color. The first one was nail fungus. Check if your nails have turned white, become thick, or if you feel any itching. If you notice these signs, it might be nail fungus. Next, the second condition I introduced was green nail. The nail turns green. This is caused by a bacterial infection in the nail, often in women who get their nails done. I explained that this is especially common among women. And the third one was longitudinal ridges on the nails, the vertical lines on the nails. This is not a dangerous SOS sign, but rather a change that happens to your nails as you get older, so there's no need to worry. And the fourth one, it was Terry's nails, where the white part covers the entire nail. Terry's nails can be an SOS sign of serious diseases of the heart, liver, kidneys, or pancreas. So please check your own nails and take a look. Fifth, check if the area around your nails is red. This is called pharyngeal erythema. It could be an initial symptom of connective tissue diseases such as rheumatoid arthritis. And sixth, if you see a black line running through your nail. There are 2 patterns of this, benign and malignant, as I explained. In particular, the malignant type could be a cancer called melanoma. Be sure to check if the black area is getting wider or if it is spreading to the skin. Make sure to keep an eye on this. Now, I will introduce 3 cases where changes in the shape of your nails can be warning signs from your body. Here is the 7th SOS sign from your nails that you might regret not knowing. Please look at this image. The hand on the left is a normal hand. Now look at the hand on the right. Can you see that the tip of the finger is round and swollen? This is actually a sign of illness. This condition is called clubbed fingers because the fingers resemble drumsticks. If you look closely, you can see that the fingertips are indeed swollen like drumsticks. People who have clubbed fingers may have dangerous diseases in their heart or lungs, especially the lungs. It is said that about 17% of people with lung cancer show clubbing. So if you notice this sign, I strongly recommend that you see a doctor. There's also a simple way to check if you have clubbed fingers. Please try it yourself. Put your nails together like this. And when you look at them like this, you can see a diamond-shaped gap between your nails. Having this gap is a sign that everything is normal. For people with clubbed fingers, this gap between the nails disappears, so please try it yourself. If you notice the gap is gone, there is a higher possibility of clubbing, so please be careful. Here are the 8th and 9th SOS signs from your nails that you might regret not knowing. I'll explain them together. Here is the first one. This is called a split nail, where the nail is layered in two. And here is another photo. This is called spoon nails. Normally, nails are rounded and raised, but in this case, they are shaped like a spoon. This is the kind of change in the nails we're talking about. Both split nails and spoon nails are likely to be important signs from your body about certain diseases. What disease is that? It's anemia. Anemia is when you don't have enough blood, causing you to feel faint, dizzy, or short of breath because the materials needed to make blood are lacking. Iron. It's caused by a lack of iron. Anemia caused by a lack of iron is called iron deficiency anemia, and with this type of anemia, split nails and spoon nails are commonly seen. What you need to be careful about is that people with split nails often do work involving water on a regular basis. Their nails can become rough, or if they bump their nails and damage them, they can also develop split nails. So having split nails doesn't necessarily mean you have anemia. However, this is what's called spoon nails, as shown in this image. The nails are sunken in, and as they grow, they curve upward. Such findings are said to be characteristic of anemia, so please consider visiting a hospital. At YouTube Medical University, we share fun trivia and useful information that can help you become healthier starting tomorrow, all from a doctor's perspective. We'll continue sharing information thoughtfully to help everyone live vibrant lives, so I'd appreciate it if you subscribe to the channel, and if you don't mind, in the comments section, please let us know if you've noticed any changes in your nails, or if your nails looked a certain way when you had a particular illness. If you have any such information, please share it in the comments. Also, whether you give this video a thumbs up or a thumbs down, your feedback will help me with future videos. Well then, see you in the next video.